Living with HIV poses a number of challenges, but one of the greatest difficulties HIV patients face is supporting themselves and their families. That's why the International Centre for AIDS Care and Treatment Programmes, or ICAP, at Columbia University's Mailman School of Public Health supports organisations like the Empowerment Centre and Fashion House in the Nigerian city of Kaduna. The centre emerged from the collective vision of patient support group members who pooled their own resources to purchase sewing machines and supplies in order to run a fashion company.
We believe that treatment alone is not enough. We need to do more than beautiful. That's why we want to buy money from care support group. And from this money of care support group, that group married together to put up and permanent center.
The centre's training programs follow an apprenticeship model. After completing their training, individuals are eligible for loans from the centre to start their own businesses. One such individual is Abdul, who has used the loan to set up his own telephone call centre.
Formally, before I collected the loan from the support group, I wasn't doing anything. My wife was the one who's taking care of my family. But when I got the loan from the support group, I now established a calling center, a place where people come and make calls and buy cards. I can now help my family without giving them money for feeding, and I can now transform myself to the hospital to run treatment.
Fostering this kind of self-sufficiency is a key part of ICAP's overall strategy.
ICAP's response to the challenges of HIV is to focus on it being a family disease. It not only affects adults but also their children, and it forces us to develop the systems that really take care not just of the individual but with the whole family together. Patient empowerment can make all the difference. In HIV, supporting people with HIV and bringing them in at every stage of the program, in terms of designing the programs, in terms of implementing the programs, in terms of supporting others within their communities, is very critical to making these programs respond to the needs of the families affected by HIV.
A definition of sexually transmitted diseases.
ICAP programs are built on the belief that HIV/AIDS services should be universally available and accessible. ICAP also recognises that host countries should be at the heart of designing and implementing the programs. In Nigeria, as in all ICAP countries, the work taking place with local organisations is extensive.
In order to support the government of Kaduna State to roll out this program, ICAP has supported upgrading of the infrastructure, both the service points, including the laboratories, the pharmacies and the ART clinics, as well as the antenatal clinics and some of the other service areas in the hospital. We upgrade them through innovations. We provided equipment with laboratories and storage facilities for drugs in all the pharmacies.
ICAP is not there to tell countries what to do about HIV/AIDS. Just like the support it's giving to the local hospital here in Kaduna, ICAP's role is to act as a guide, mentor and advisor to the people on the ground who really make the difference.
HIV is a chronic condition, and in that way it is quite unique. In order to tackle HIV, one has to transform the health system to be able to provide the kind of continuity, comprehensive care that's so essential to taking care of people and families with HIV. The reality is that often it is people on the ground who have the answers to the problems. It is the communities, it's the governments, it's the various organizations who have the answers to many of the challenges in facing and confronting HIV. And our role in ICAP is to work behind the scenes to support these organizations, these communities, in helping them achieve the programs that they really want to achieve.